Healthcare really centers around this very simple goal. You're trying to deliver a very high quality outcome with the least amount of resources expended to reach that outcome. Unfortunately, nothing in healthcare really operates that way when you think about it.
Employers, in trying to manage healthcare costs, rely on data. And it turns out that claim data from an insurance company is organized around diagnosis, which almost any official source, the AMA, the CDC, etc., will tell you are wrong 17 to 30% of the time. In addition, that data tends to be organized through codes. They were designed to confer billing truth, not necessarily clinical truth. And it's, after all, clinical truth that ultimately gives us the knowledge we need to determine whether some action could be taken to improve either the outcomes for the employees or maybe even the cost structure of delivering the benefits. It became clear to us that what we were going to have to do is rethink what it is we were delivering to the employer. The first thing we have to do is reorganize that transactional data into episodes of care. A typical employer reporting out of a claim system would say, Mr. Employer, you had 212 MRIs last year. Whereas an episode of care is going to say you had 6 MRIs on 31-year-old females for, ACL injury to the left knee. I mean, it gets very specific. And so it becomes considerably more illustrative of what's actually going on. So for instance, somebody charges one of my employers $3,000 for an MRI, and we know that we could get that done for $800. It kind of irritates the financial manager at the employer, right? The issue, though, that we found is as we directed care to the $600 or $800 MRI sources, in fact, there was a much higher percentage of redos on those when we actually looked at episodes of care. The long and short of it is you wouldn't get that picture without looking at the entire episode of care. We're in a much, much better place to determine what are the remedies to either deficiencies in quality, deficiencies in outcome, or deficiencies in cost against what our goals are. The episode of care allows us to essentially look at the cost of an automobile rather than buying that automobile based on the cost of a steering wheel.
When a company can say that their healthcare costs are less today than they were 5 years ago, that'll get any CFO's attention, and rightly so, because they are bending the curve where a lot of companies are unable to do that. And at the end of the day, we all want to have quality healthcare. We all want to pay a reasonable price, and we all want to be able to understand how that's measured and how we can account to get from A to B to get there.